Welcome to the Deep Dive. We're here to sort through all the noise and pull out what you really need to know, maybe find a few surprises, and hopefully keep you listening.
That's the plan.
Today, we are plunging into a topic that, well, it affects pretty much everyone at some point. Antibiotics.
Definitely.
Our mission. Basically to unlock the key info you need, what they are, how they actually do their job, the different kinds, and those really crucial details about their impact.
And it's more than just facts and figures. In a world grappling with infections, really getting antibiotics, it's just so important. This dive should give you that solid foundation.
Yeah, not just the what, but the why. Right.
Exactly, why it all matters.
Okay, let's unpack this and get right to the core. So fundamentally, antibiotics are chemicals, designed specifically to inhibit bacteria.
Target those little guys.
And it's fascinating where they come from. Some are natural, made by living things like molds.
Like penicillin's origin story.
Right. Others are totally synthetic, made in labs. And now there's even genetic engineering involved.
Technology keeps moving.
So when they fight bacteria, there's sort of two main approaches. You've got bacteriostatic types. These basically hit the pause button. They stop the bacteria from growing, from multiplying.
Hold the line, essentially.
Then you have the bactericidal ones. These are more direct. They actually kill the bacteria.
Take them out. That difference is really, really key when it comes to treatment.
How so?
Well, think of your body's immune system as like its own defense force. A bacteriostatic antibiotic stops the bacterial invaders from overwhelming your defenses. It buys time for your immune system to rally and win.
Okay, I see.
Whereas a bactericidal one is more like calling in an airstrike. It directly eliminates the threat. But ultimately, the aim is always the same. Knock down the number of bacteria enough for your body to handle the rest.
I mean, you definitely know when your body needs that help, right? The typical signs of infection: fever, feeling wiped out,
lethargy,
that deep sleepiness,
yeah,
and the classic signs of inflammation, redness, swelling, heat, pain. That's the cue.
That's your body saying, Houston, we have a problem.
So, okay, you're feeling sick. How do doctors choose the right antibiotic weapon? First step, seems crucial, is identifying the actual bug causing the trouble. Usually from a culture, right?
Absolutely. You need to know your enemy. And once you identify the bacterium, the choice of antibiotic often comes down to some basic classifications.
Classifications like?
Like gram-positive versus gram-negative. It's about how their cell walls react to a specific stain test. Gram-positive bacteria hold the stain.
Like a stubborn coat?
Kind of, yeah. While gram-negative ones lose it easily, their outer layers are just structured differently.
Okay.
And then there's aerobic versus anaerobic. Do they need oxygen to live or not?
Aerobic needs it, anaerobic doesn't.
Precisely. And these differences are fundamental because an antibiotic that works great against one type might be totally useless against another. It's like matching the right key to the right lock.
Gotcha. Now here's where things get, well, a bit worrying for everyone these days. Antibiotic resistance.
Oh, yeah. The big challenge.
Bacteria are just incredibly adaptable, aren't they?
Yeah.
They evolve. And the longer we use a particular antibiotic,
the more chances the bacteria have had to figure out a way around it, to develop resistance.
It really is like a constant arms race.
It is. And the consequences are serious. Treatments fail, illnesses get worse, hospital stays get longer.
And sometimes infections become almost untreatable.
That's the scary part. It makes understanding these drugs and how resistance happens incredibly important for all of us.
Right. So with that sort of heavy background, let's dive into some of the specific antibiotic families.
Yeah.
Different strategies, different uses, different things to watch out for.
Dude's good. Let's explore the toolkit.
First up, aminoglycosides. These are pretty potent, often used for serious infections, especially from those gram-negative aerobic bacteria.
The oxygen lovers?
Yeah. They're bactericidal. They kill by messing up the bacteria's protein production. But here's a big one to remember. They can be toxic.
Specifically?
Kidney toxicity, nephrotoxicity, and also ototoxicity, which means they can damage hearing and balance.
That's significant.
Definitely. And it leads to some slightly counterintuitive advice. If you're taking one, say gentamicin, and you get nausea or diarrhea,
you might want to stop drinking or eating.
But you shouldn't. It's actually crucial to drink lots of fluids and maintain nutrition to help your kidneys flush the drug out and minimize that toxicity risk.
That's a really key point for patients. Stay hydrated.
Absolutely. Okay, next group, the carbapenems. These are newer, broad spectrum, meaning they hit both gram-positive and gram-negative bacteria.
Versatile.
Very. They're also bactericidal. They work by stopping the bacteria from building their cell membrane properly, essentially causing them to fall apart.
Potent mechanism.
But they come with their own serious considerations, things like severe gut inflammation, sometimes caused by an opportunistic infection called C. diff.
Clostridium difficile,
Yeah,
nasty stuff, can cause severe dehydration.
Exactly. And another critical point. Carbapenems, like meropenem, are generally a no-go for people with seizure disorders.
Good to know. Definitely a contraindication to watch for.
Okay, shifting gears a bit. Cephalosporins. Think of these as cousins to penicillin. Similar structure, similar action sometimes.
Right, I've heard that comparison.
They can be both bactericidal and bacteriostatic. They interfere with building the cell wall when bacteria try to divide. The most common side effects, usually GI tract stuff.
Like diarrhea.
Yeah, potentially. So, healthcare folks often need to keep an eye on fluid levels and nutrition. You'll hear about different generations of these, like cefadroxil or maybe cefdinir.
Each with slightly different coverage.
Exactly. Okay, under the fluoroquinolones, another relatively modern synthetic class. Broad spectrum again, especially good against gram-negative bacteria. Often used for UTIs, respiratory infections, skin stuff.
Common infections, then.
Right. They're bactericidal. They mess with the bacteria's DNA replication, stop them from making copies of themselves.
Effective. Any common side effects?
Headaches, dizziness are pretty common. But here's something important, maybe unexpected. There's a known, though rare, risk of tendon rupture with some fluoroquinolones.
Wow, really?
No.
Tendons.
Yeah, so something to be aware of, especially if you're physically active. The big one here is ciprofloxacin, or Cipro, and generally not for pregnant or lactating women.
That tendon issue really highlights why knowing these specific details for each class is vital. It's not just about effectiveness, but safety.
Couldn't agree more. And now for a history lesson. Penicillins, the originals, the very first antibiotic used clinically. A total game changer.
Well, absolutely revolutionary.
They're bactericidal, also targeting that cell wall construction. Like cephalosporins and others, the main side effects tend to be, you guessed it, GI issues. Amoxicillin is probably the one most people recognize today.
A household name, almost.
Almost. Okay, then we have sulfonamides, or sulfa drugs. These are bacteriostatic. They work by blocking something called PABA.
Paraminobenzoic acid.
Right, that. Bacteria needed to make folic acid, which they need to survive. So sulfonamides basically starve them of a key nutrient.
Clever approach.
But here's a critical interaction. Don't mix them with thiazide diuretics, common blood pressure meds. There's a cross-sensitivity. Contromoxazole is a frequently used one.
Good flag for potential interactions.
Next up, tetracyclines. These actually came from soil mold originally. They're bacteriostatic, stopping protein synthesis so bacteria can't replicate.
What are they typically used for?
Various infections, but interestingly also sometimes for acne. Main side effects are GI, but, and this is important, they can potentially damage developing teeth and bones.
Ah, so that explains why they're often avoided in kids in pregnancy.
Exactly. And it also means you absolutely have to take them on an empty stomach. Food, especially dairy, really messes with their absorption. Doxycycline's a very common example.
Empty stomach, got it. Another key patient point.
Definitely. Okay, nearly there. Let's talk about antimycobacterials. These are highly specialized drugs.
For specific targets, right?
Yeah, they go after the pathogens, causing things like tuberculosis, TB, and leprosy. They act on the bacteria's DNA, stopping growth and eventually killing them.
Tough diseases require tough drugs.
For sure. And a really important interaction to know. Combining rifampin with another TB drug, isoniazid, can potentially lead to liver toxicity. It needs careful monitoring.
Liver function is key there.
Okay, so those are the major groups we wanted to cover in detail. But there are others too, right? Like ketolides, lincosamides, macrolides.
Macrolides are important, like erythromycin or azithromycin, the Z-Pack.
Ah, yes, the Z-Pack. And for those macrolides, another food interaction note. Best taken on an empty stomach with water, maybe an hour before or a couple hours after eating, because food decreases absorption.
Good tip. And it's worth mentioning, the field doesn't stand still. New classes, new adjuncts are always being developed, things like daptomycin, tigecycline.
Constantly innovating.
Absolutely necessary, especially with that resistance challenge we talked about.
So, after all that, what's the big takeaway? What does this all mean for you listening right now? How can you use this info?
Well, I think understanding these different mechanisms, bactericidal versus bacteriostatic, cell wall versus DNA targets, plus the common side effects, those crucial drug-food interactions, it just empowers you.
Empowers you how?
It makes you a more informed participant in your own healthcare. You can understand why a specific antibiotic was chosen for your infection. You know what to potentially expect, what questions you might need to ask your doctor or pharmacist.
You're not just passively taking pills.
Exactly. You become an active partner in getting better. You understand the strategy.
That makes a lot of sense. Well, thank you for joining us on this pretty detailed deep dive into the world of antibiotics. It's complicated, but so, so important.
Absolutely vital. A fascinating area of science with huge implications for all of us.
Indeed. And maybe is a final thought to leave you with.
Go on.
Considering everything we've discussed, the evolution of bacteria, resistance, the pipeline of new drugs,
Yeah.
what challenges and maybe opportunities do you see ahead, in this global fight to keep antibiotics working for generations to come?
That's a big question. Something definitely worth pondering. What role can we all play in preserving these life-saving medicines?